Cardiac implantable electronic device (CIED) infections are a serious complication of this effective, validated therapy. CIED infections are most frequently caused by staphylococci and, to a lesser degree, by other pathogens. CIED infection prophylaxis stands on preoperative administration of IV antibiotics. Though cornerstone in prevention of surgical site infections, antibiotics are less effective when a device is implanted in the body. Importantly, antibiotics need to be conveyed from blood to tissues where they maintain an appropriate bactericidal concentration according to their pharmacodynamic and pharmacokinetic properties. Introducing antibiotics into the open pocket without being able to guarantee optimal dosage and concentration for an extensive period of time is not effective and can also induce antibiotic resistance. Decontaminate the skin where the incision will be performed. However, bacteria normally reside in the hair follicle where skin cleansers and disinfectants cannot reach them. Perform a surgical incision to create a subcutaneous pocket for the CIED. Cutting the skin opens an entry for bacteria into the pocket. After CIED insertion into the surgical pocket, isolated bacteria aggregate into colonies on the CIED surface owing to specific glycoproteins adhesins, thus becoming shielded from antibiotics and forming a bacterial biofilm. In particular conditions, some bacterial colonies can later leave the aggregate biofilm and form a sort of antibiotic, antibody, and phagocite-resistant infectious embolus that infects various body areas, often including the heart. Once initiated, treatment of the infection is complex, as it requires complete removal of all hardware, CIED and leads, besides targeted antibiotic therapy that is specific for the pathogen causing the infection. Despite hardware removal and antibiotic therapy, cumulative mortality due to infective complications is at least 20% at 3 years. This disappointing outcome is due to the low efficacy of antibiotic therapy on colonies of bacterial biofilm disseminated in the body at this stage. Bacteria aggregate into biofilm in 12 to 30 minutes. The event is followed by rapid initial growth and subsequent dissemination under favorable circumstances. The bacterial biofilm forms on the CIED hardware in a few minutes and keeps in balance with the host immune defense, but can cause an infection and disseminate into the body at a later stage, even after years, when a trigger sets a favorable situation. An initial contact phase is rapidly followed by irreversible adhesion. The biofilm can generate early or late infections, remaining dormant until dissemination, if any. Hence, endocarditis can often originate from subcutaneous pocket infection. The only truly effective form of prevention is the avoidance of biofilm formation by shielding medical devices with envelopes that prevent the bond between bacterial adhesins and the protein layer of the host matrix. In fact, if bacteria were to remain isolated, they will be much more susceptible to the action of antibiotics and would, therefore, be neutralized. Tyrx absorbable antibacterial envelope that is indicated to prevent infections in patients submitted to electronic cardiac device implantation procedures. Tyrx is a steroid pocket designed to contain either a generator of pacemaker impulses or a defibrillator. It achieves an 80 to 90% reduction in CIED infections in high-risk patients. The antibacterial envelope is a filament mesh of glycolide, caprolactone, and 3-methylene carbonate. Moreover, the mesh is coated with a bioabsorbable polyacrylate polymer, sprayed with the amino acid tyrosine, previously impregnated with the correct dosage of antibiotics that dissociates over time, mainly through hydrolysis. The tyrosine polymer, impregnated with minocycline and rifampicin, guarantees tailored, scheduled, and prolonged release of the two antibiotics with MIC90 for 7 to 10 days. Most importantly, this polymer features daily release of the optimal dosage of the two antibiotics. This ensures the maximal efficacy of the antibiotics while avoiding antibiotic resistance. The whole envelope is absorbed in about 9 weeks. Tyrx considerably reduces the formation of biofilm. Tyrx, the absorbable antibacterial envelope, is available in two versions: medium for pacemakers and large for implantable defibrillators, both with a correct and balanced concentration of the two synergistic antibiotics, namely rifampicin and minocycline. Tyrx is especially recommended in patients at high infection risk, as indicated by Mittel, Sharif, and Kerber. The 14 factors predisposing to CIED infection indicated in the table identify those patients at highest risk of developing CIED infection. According to estimates, these patients account for 5 to 20% of cases. The antibacterial envelope Tyrx is the ideal solution for the prevention of CIED infections.